I am a graduate of King Edward Medical College, and most of you will know Kamkana, my alumni, was the first one who was the first professional organization who started in United States. And APPNA, Central APPNA actually followed, and the founders were the Chemcolians. I'm a cardiologist by profession and work with NYU. I practice pretty much non-invasive cardiology now, but I'm on the faculty practice of the NYU for last many years. Few things I would like to say ahead of my formal speech. I would like to acknowledge a few of our senior, besides my executive committee, our senior APPNA members who actually were the founders of APPNA New York chapter. One of them is Dr. Izharul Haq. He is here today. Dr. Sarwar Gumman, Dr. Asim Malik. Unfortunately, he could not be here because of health issues. And then I would like to acknowledge people who helped me to bring all these activities throughout the year in New York. Besides my executive committee, the people who helped me obviously is my own family, my beautiful wife Saima, and my two children, Ryan and Haris, who always help me with the technology-related issues. And all this coloring and the table covers and the flower arrangement was the idea of Saima. Thank you very much. So as you know, I'm very thankful to my executive committee and all the members who not only work throughout the year to make every event successful, and especially this gala dinner. One of the men I wanted to say, the current members who actually helped me, they are either they were behind the scene or up front. Again, Dr. Sarwar Gumman, Dr. Parvez Iqbal, Dr. Ghulam Shehzad, and Dr. Muhammad Aslam, who is the coolest person after me in APPNA. Each time I call him for anything, he says, "Oh, Dr. Sahab, ho jayega, fikr na karo." And it always happened on time, the way I wanted. Thank you, Dr. Aslam. I have to acknowledge that a lot of time when I ask people to join APPNA New York chapter or Central APPNA, they always ask me the first question, what is APPNA is going to do for us? So just for your knowledge, APPNA do not have a cashback program, but the answer lies in this hall today. We are here together celebrating because of the APPNA. APPNA provide you the biggest platform to have get-togethers, to have your social gathering, people make alliances, people do fundraising, community events, charity events based on their communication and your alliance to the APPNA. So I encourage everyone, please join who hasn't joined. I think you will not regret. APPNA New York chapter, as you know, or most of you know, is one of the largest chapters in APPNA. We do events throughout the years. We always started with this year we started with our Eid Milan party, which was very successful, well attended and well enjoyed by our members. And of course, there was no charge to the members either, so this should make you happy. Then the biggest event we have was for the young physicians. We have students and young residents who are looking for residencies into United States, looking for observerships. So there were about 150 of them. And I would like to thank you, Dr. Ghulamullah Shehzad, Dr. Salim Shehzad, and Dr. Afzal Mali for taking the lead. And thank you very much. Of course, APPNA cannot provide residencies to all the students, but the way we help them is to guide them for the interviews, for their personal statement, for their presentations. and how to do and what not to do. I think it's quite helpful. And then we have a network now of physicians who offer observerships to upcoming students and the residents. I think that's a big achievement. Then we have APPNA Picnic. It was in the Hudson, by the Hudson River. I think people enjoyed a lot. 150 people attended. And that's our annual tradition as well. Then we have a upstate New York meeting, which was attended by our upstate New York members. And this is the climax, which is an annual gala dinner. We always do around this time. And it's always 300 to 300 and between 300 to 325 members who attend the gala. Again, I would like to thank everybody who is here today. And I want everybody to be engaged any shape or form they can, especially our physicians who are in private practice or in academics. One of the things we are working right now, we would like to involve our city government. New York City, as you know, its own health and human corporation. I think the name of the corporation that's owned by the city or run by the city. They have like 11 to 13 hospitals. So right now we took some initiative with our sister organization APEC also to bring nurses. And I think we are moving forward and looking forward to whoever the upcoming mayor and the city government will be to facilitate our upcoming physicians to provide them with the observerships or whatever shape or form they can help us around, or some research opportunities for the young physicians. Now, in the end, I would like to say, as you know, event of this scale, it's not easy to manage. We are all physicians and we are all volunteers. And believe me, all the executive members, executive committee, they bought tickets. Nobody's free here. And we take pride in doing that. And as you know, especially the year-round events, it takes a lot of time from the family, from your profession. I appreciate all my executive committee members and the members behind the scene who I already mentioned. And they worked a lot day and night. We have several Zoom meetings to arrange all this. Everything that went good, the credit goes to the host committee, I mean executive committee and our senior members. But if there are any flaws, any weaknesses, you can blame me, because as a president, it's my responsibility. But I would always welcome positive criticism, but not the criticism like in Pakistan. Just to give an example, people go to the wedding and after eating, if they could not find anything wrong, they will say, oh, the bottle of Coca-Cola was counterfeited. That's why I could not burp. But, but believe me, the Coca-Cola today is genuine. If nobody could burp, they should see our GI fellows. Now, thank you very much. Long live Apna.